Hi, folks. My name is Dr. Amy Pearlman. I'm a board-certified urologist with expertise in sexual, hormonal, and genitourinary health. And I acknowledge that a big barrier for a lot of men coming in for a consultation on penile girth enhancement is simply not knowing what to expect during that visit. And because it's a topic that we don't commonly discuss, that can be barrier enough to keep someone out of the office. So why don't I take you behind the scenes a little bit here and give you the scoop, the inside scoop on what we may discuss. Most of the time, patients are coming in, they have the full consultation, and they're ready to proceed. So let's talk about what that next part looks like. So I'll bring my patients to the room right next to my consultation room, and I will step out of the room. I'll let them undress, and then they'll bring their bottoms down, and I will come back into the room, and I will take a picture using a HIPAA secure platform with the person standing up, and this allows us to track their progress over time looking at the pictures. So that is really helpful. There are, plenty of times where patients will ask, oh, can I see my prior pictures? And we'll pull them up and we can see their growth in real time, which is really interesting to look at with patients. So then after that, I'll have my patients lay down on my procedural chair. I'll usually dim the lights a little bit to make it a bit more comfortable. And then I'm going to take baseline measurements. For baseline measurements, I'm just using a simple measuring tape right here, and I'm going to measure the stretched penile length from the pubic bone to the tip of the penis in the flaccid state. And I'm also going to measure the penis about an inch from the base of the penis when it comes to girth. So, the penis, when it comes to girth, is going to, vary, and it typically tapers towards the tip of the penis. So I'm not measuring, the girth all throughout the penis, but I try to stay consistent with my measurements. So I'm typically going to measure around an inch from the base of the penis just to keep my measurements fairly consistent throughout the treatment process. So we take those measurements, and I'll take it in centimeters and inches, and my patients say, oh, where am I at? And then we'll kind of compare where they thought they were at with my actual measurements. Something important to keep in mind is the measurements are going to greatly vary depending on exactly how much blood flow is in the penis. So if someone is completely flaccid, then they're going to have a smaller measurement than if they have a partial erection or a full erection. So most of the time when I'm doing these measurements, my patient is fully flaccid. If they're kind of nervous or they're a little bit chilly or their penis is a little bit retracted, then yeah, that can definitely make their measurements even a little bit smaller. And then if someone is partially erect or fully erect, I'm going to make a note of that in my chart. And it's totally fine if these things happen. Sometimes they do, not a problem. But I will make a note of that in my chart, because the next time I'm measuring that person, if he measures smaller after I've put some, filler in there, it's not that he lost filler or the filler didn't do what it was supposed to do. Sometimes he started off and he was partially erect, and the next time I'm measuring, he's fully flaccid. And so that measurement could be, centimeters, 1, 2, 3 centimeters difference, depending on exactly how much blood flow is in the penis. So I'll definitely make note of that in my chart. All right. So once we get those measurements, we are going to numb the penis. And I use little insulin needles like this. And this we use just to inject tiny amounts of lidocaine along the sides of the penis. And then after that, I use a different needle and syringe to inject additional lidocaine in those same columns. And the additional lidocaine, what it does is it creates a space where then I'm going to inject the filler, because in a penis without filler, there are only potential spaces in between the layers, but no actual space. So I have to make that space with the lidocaine, which really serves two purposes. One is pain control, so you don't end up feeling anything. And two, it just hydrodistends that whole plane, so I can easily get the filler where I want it. All right, so once we get those columns of anesthetic on either side of the penis, then I'm going to be injecting these bad boys into the penis. So depending on the length of the penis will determine how many units of filler I put in. Typically, I'm putting in 5 units of filler at a time. Most of my patients are looking for an increase of an inch in their girth. And so typically that's going to require about 20 units. So if we just make the math easy, it's typically 5 units over 4 sessions. There are some patients that are coming in from out of town that say, look, is there any way that I can, do the 20 units in 3 sessions? And so what I tell those guys is, well, let me start off by doing 5 or 6 units during that initial session. Let me see how let me just develop those columns first. Let me get this capsule to, to form around those columns, to minimize movement in the future. And let me make sure it looks good after the first session. And then if everything looks good and there's not much movement, then I would feel comfortable with subsequent sessions putting more filler in at a time. So there are times where certainly I can get the 20 units in a good spot and injected within 3 sessions. All right. And that's about it. So the whole procedure, I mean, sometimes the consultation could take 10 minutes if my patients are very simple and really don't want to discuss anything else other than filler and they've already done all their research. And sometimes the consultations take an hour and a half or 2 hours where we're talking about testosterone and urinary health and prostate health and sexual function and girth enhancement. So they can be sort of as short or as long as the person is interested in having that consultation. The procedure itself, usually the first session takes a little bit longer because I'm doing more explaining. People aren't sure what to expect. So the initial session will take a little bit longer. For subsequent sessions, they'll take about 30, 45 minutes, depending on how much I'm yapping away with the patient. And at the end of the procedure, I'm customizing the size of the sleeve to put on the penis. So the person's going home with a sleeve on his penis, and I teach him how to put it on and take it off. So that's about it. That's what, you can expect during that initial consultation. I find that a lot of people come in, they're extremely nervous to see me to talk about this issue. And honestly, I find that when they walk out, they got this pep in their step. They're more knowledgeable about their health as a man. They are walking out with some more confidence, and they're some of my happiest patients. So it's been really fun to treat men with girth enhancement. And just has been an opportunity. It's like this door that a lot of men will walk through to enter into the healthcare system. And it allows me to just have really fun conversations with men about their overall health. So thanks for tuning in. I hope you see that the discussion on girth enhancement doesn't have to be a scary discussion. It can be a very normal conversation where we talk about health and we talk about men's health concerns and we talk about what your girth goals are. And those can actually be very fun and eye-opening conversations to have. So thanks for tuning in, and please subscribe to my channel to learn more about the ins and outs of men's health.